Now, it's not a U-turn and they're not backing down. Downing Street insisted today, but David Cameron is planning to make changes to his flagship NHS reforms. The programme understands that some key proposals will be curbed. Private firms won't be able to cherry-pick the best services, and the new GPs consortia will put value for money above market forces. Mr Cameron, together with his deputy Nick Clegg, will also launch what they call a listening exercise later this week in an effort to reassure critics. Our social affairs correspondent Victoria MacDonald reports.
Andrew Lansley, greedy Andrew Lansley.
It's a YouTube sensation, a 22-year-old rapper opposing, of all subjects, the NHS reforms.
So the budget of the PCTs, he wants to hand to the GPs, oh please. Dumb geeks are going to buy from any willing provider and get care from private companies.
It's hard to rhyme the words GP commissioning, and the Health Secretary Andrew Lansley himself was said to be impressed. But underlying this is a more serious problem. The government is facing increasing opposition to its NHS bill. And now the Prime Minister, who has firmly nailed his colours to the masts of reform, is said to be worried. And today there are reports of climb downs, of U-turns, all of which Downing Street is denying. But it is now clear that the Prime Minister is preparing, even as the bill is going through Parliament, to row back on some of this legislation, that he has agreed to make some important amendments. It is understood that there will be changes to the NHS Health and Social Care Bill to limit the way private companies will be able to work, that GP consortia, that's the doctors all banded together to buy our healthcare, that they will be made more publicly accountable, and that value for money will be promoted above competition. It's the other way round at the moment. Will this be enough? Not according to Labour's health spokesman.
A third of the bill sets up a new system of competition, puts the NHS on a totally different basis for the future, opening up all parts of the NHS to the private sector, setting at its heart a new market regulator with the job to promote competition. Not better patient care, not better safety for patients, not even better value for money. And this means a full-blown market for the NHS. It means competition law increasingly playing a part in the NHS for the future, and that's not good for our NHS.
Lady here.
However, this week the Prime Minister and Nick Clegg will jointly announce a listening exercise, sitting down with critics to try somewhat belatedly to explain the reforms. Opposition to the reforms has been growing, not least amongst grassroots Lib Dems. To Mr Clegg's embarrassment, they voted against the plans for the NHS at last month's spring conference. And of course there are the local elections coming up, and the Lib Dems are afraid that they're going to get the blame. So this is being seen as Nick Clegg's last chance to get some changes made. I've also been told that one of their lead MPs on health will tomorrow present a paper to his colleagues in there outlining exactly what the concerns over these reforms are. But there was a warning today too from the NHS Confederation against tinkering at the edges.
The difficulty the government have got is these reforms are a very complicated set of interrelated measures, and amending bits of them could have the effect of unravelling large portions of the whole reform. So we may have the worst of both worlds.
The NHS is not for sale.
The problem for David Cameron is that the reforms are already underway. The horse is bolted, as one insider put it, and that to stop them now could lead to even more chaos.